good.
Easy.
Good, I got it.
Here. No. Just have a seat. You okay? Here, we're gonna take a look, okay?
It's badly infected. We can't leave him here.
Call transport now.
I'm fine.
We're taking you to New Amsterdam, okay?
I need a full debridement kit, general surgery, and an OR now.
My bike. Somebody's got to watch it. That's all I have.
Someone grab his bike. I'll check.
Remaining bone.
Crap.
Okay, Domino. Your foot is infected really bad.
You gotta fix it though, right?
I can't, my friend. Look, the surgeons are gonna come and they're gonna take you to the OR. Or most likely, they're gonna have to amputate your foot.
What? No.
I'm
What
so
are you
sorry,
talking
but
about?
you are in safe
Oh,
hands.
hold on a
Domino.
second. Dr. Bloom, hold on a second. Dr. Bloom, please don't let them take my foot. Dr. Bloom, please. Please, Dr. Bloom. Not the foot, Dr. Bloom. Please.
No, Kitch. Go back to where we picked up Domino and grab his bike.
What do you want me to do with the bike?
You pick it up and you put it in your ambulance. And you know what? It better be here by the time he wakes up. Go now! Thank you. Surgery went as well as we could have hoped. Just below the knee.
Don't worry, got your bike and all your merch down to ED.
Yo, one of my boys needs a new pair of earbuds, so...
Let's see if he needs a new bike, too.
Domino, look, I know this is shocking, but you could have died out there on the sidewalk. You're gonna recover, and we're gonna help you.
Seeds? What am I supposed to do with these?
Plant them. Your diabetes got out of control because medication alone can only do so much. You have to completely change the way you're eating to have a fighting chance. Leafy greens, legumes, lean proteins, healthy living.
What, I'm expected to be Farmer John now?
Oh, I'm sorry. I thought that I was talking to the guy who made 50 bucks up us in 5 minutes flat. Bringing you an opportunity, but if that ain't you anymore...
All right. Whoa. Take it easy. Ain't no reason to put that kind of energy out there.
Okay, now that land out in Desmond Park, they are gonna build something on it. But honestly, that's gonna take some time.
Yeah, with inspections, planning. Those permits gonna take longer than a G train on Sunday night.
In the meantime, who's to say what happens on that land?
Maybe somebody plants some vegetables, sells the rest for a very
Say no more. It makes dollars and makes sense. Thank you.
Captain Trevor Jackson.
Ma'am.
Army.
Ranger, 1st Battalion, 75th Regiment.
Cool. Follow my pen line.
You serve?
Navy. Reservist now. You're a long way from Georgia. What brings you in today?
Bender. It's my fault. I got lightheaded. Thought I was gonna pass out.
Well, you've been drinking, soldier?
No, sir.
It's blood work. You two in time for business, pleasure?
Visiting my family, Lincoln Park.
I gotta get back to duty. Mother-in-law's cooking. He's packing all the pounds.
Kids?
Not yet.
One day, baby, one day. I don't want her to have to raise kids alone while I'm still being deployed.
Captain Jackson, are you diabetic?
Not.
I'm afraid these numbers indicate differently. Your blood sugar's at 350.
No, there's no way I have diabetes.
Baby, listen to the doctor.
If I have diabetes, they won't deploy me. That's it, I'm done. And I can't be a soldier anymore. You understand?
Well, it's true you don't have the classic risk factors. Obesity, family history, and your white blood count is elevated, so it's possible there's some underlying infection driving your blood glucose up.
Okay.
We'll run some more tests, see if that's the case.
Please.
All right. We'll be right back.
It's gonna be okay, honey.
Dr. Charles, you have a minute?
Sit down. Don't mind if I eat? I've missed breakfast.
Please. It's my patient, Captain Jackson. He's a physically fit, active service Army Ranger, but his blood sugars indicate he has diabetes.
You run labs, do a CT?
His pancreas is healthy. There are no sign of tumors. His labs came back clear for infection and autoimmune disease. Can't find a reason for his diabetes, but I did find this. He fractured 2 thoracic vertebrae.
Ouch.
Exactly, so why hasn't he said anything?
Why do you think he hasn't said anything?
Overseas, I saw a number of soldiers who were away from home a lot. They were depressed.
Depressed patients tend to mask or hide pain.
Right. But the thing is, diabetes is a red flag for the military. You test positive, you don't go back to combat.
But if you're depressed about overseas deployment.
You think he might be happy to have diabetes. He's home for good. But that's not the case. Jackson's extremely upset at the possibility of not going back to active service. Something's going on with him.
Let's go say hello to Captain Jackson.
Thank you, sir. This is Dr. Charles. He's a senior attending physician here. I've asked him to consult just to make sure we're covering all our bases.
Yes, sir.
Please, as you were. You're Mrs. Jackson?
Yes.
It's nice to meet you. I just wanted to make sure that I have your history straight. So, you've seen combat before?
Yes, sir.
And this was your first tour?
7th.
7th. And
What was in the test results?
You have a couple fractured vertebrae that will heal on their own, but all your other tests failed to give us an answer. We can't find a clinical reason for your high sugars.
Clinical? What does that mean?
a physical cause.
I'm sorry, what kind of doctor are you?
He's a psychiatrist.
A shrink. Okay. I don't need a shrink. I'm not crazy.
Nobody's saying that you are.
Honey, they're just trying to help you.
How is a shrink gonna help me?
As I said, we're covering all our bases.
You think I'm faking this?
No, you can't fake blood sugar.
So what are you saying? Huh? You think I did something to myself? You think I'm a coward?
Not for a second is anybody saying you. Whoa, Mr. Jackson.
Captain, I'm out.
Hey, Mr.
Whoa,
Mr.
Captain. Captain!
Nurse, please.
Little help!
How's he doing?
Okay.
Don't think it'd be a very good idea for me to go back in there.
No.
Wow, 7 tours. That must be tough.
I knew what I was signing up for. I'm proud of my husband,
Of course. I know you must miss him and worry about him.
like every soldier's wife.
And I know the illness is a blow, but at least, you have him home and he's close, right? Mrs. Jackson?
I'm sorry, I don't want these to get cold.
I won't keep you long. In reviewing your husband's symptoms, I'm pretty sure I know what's causing his diabetes. And I think you do too.
What? What are you talking about?
You don't lie a whole lot, do you? I mean, you're certainly not very good at it. To your great credit. To lie well, you have to loosen up, make eye contact, stuff like that.
I don't understand what you're saying. I mean, lie about what?
Somebody's got to go there and tell your husband the truth. I could do it. Let me hold those for you. Afraid I've got some bad news.
Oh, please, I'm having a terrible day.
About to get a little bit worse. We have a case of domestic abuse on our hands.
You could. Are you out of your mind?
That woman has been poisoning her husband with prednisone.
Why would you do something like that?
I read on the internet that if I gave him some prednisone, it would look like diabetes. I just wanted him home. Safe. It's been 10 years of worry, of nightmares. You can understand why I did it, can't you?
Well, whether I understand or not, it doesn't matter.
There's a doctor here. Her husband was a ranger, and she lost him. He's dead. Isn't it better to be sick than dead?
Why did you let it go so far? Why didn't you talk to someone?
What good would talking do? I wanted him home. Talking wouldn't bring him home.
Mrs. Jackson, I'm sorry. What you did is a crime, and I have to report it.
Am I going to go to jail?
I don't know.
We'll taper off the prednisone. Your system will purge it over the next few days. The side effects will dissipate, and your blood sugars will return to normal.
Where are they taking her?
She's turning herself into the police.
Lauren!
Captain. Easy.
We'll get through this. Together.
Hi.
Dr. Manning, I presume? I know, corny.
A little. About making jokes? Feeling better?
Compared to before, I mean, it still feels like I got hit by a truck. What happened?
Your body wasn't producing enough insulin to control your blood sugar. So it spiked and it knocked you out.
The diabetes.
Yes. But the crisis period is over. Your blood sugar levels are improving. You okay?
It's just a little tender.
You mind if I take a look?
Oh.
Pain scale 1 to 10?
12.
Okay. How long has your stomach been hurting?
A few days. I mean, it's winter break. It's just more cheap beer and pizza than usual. I figured it was just indigestion. Is it the diabetes?
No. Gallstones. I would like to run some additional blood tests and get an MRCP, a more detailed scan of your stomach, okay?
Mm-hmm.
Is there anyone I can call for you?
No, my dad's on his way.
All right.
He had them. Gallstones. They're a fat person's problem, aren't they?
They are often tied to obesity, with diabetes as well. But you know, with lifestyle changes, these things are manageable.
You mean like diet and exercise?
You're only 21. It'll be easier than you think. I'll be back shortly.
Setting up grocery delivery. Farewell, supermarket temptations.
Well, that's a good first step.
Mhm.
You know, there's some great apps for tracking calories, too.
That's way down the line. I mean, after I get a handle on GMOs, gluten, organic versus farm fresh, that's why I like fast food. It's simple.
You know what? Why don't I page the hospital's nutritionist, have her come in for a consult? You okay?
I've just been feeling a little bit short of breath, and
Just come on now?
a couple minutes ago, is it a reaction to all the meds, or?
No, they're just sparking your immune system. It shouldn't affect your breathing. Sit up for me. Lungs are clear. Is the extra oxygen helping?
No, not really.
Will, I need a hand. Stat portable chest x-ray.
What's going on?
Blood sugar's normal. White cells, amylase, lipase, they're all down. Everything's good, except now he can't breathe.
What's happening?
Your blood pressure and oxygen levels keep dropping, so we're gonna take a chest x-ray to try to figure out why.
Mass in the lung.
I'm hearing a rub. It wasn't there before.
All right, let's get an echo.
I can't breathe.
O2 keeps dropping, switching to a full face mask.
Pericardial effusion.
What does that mean?
No, keep this on. There's fluid built up around your heart. It's constricting it from beating. Bolus another liter of fluid, get 125 milligrams Solu-Medrol IV and a leave-fed drip. Page Dr. Rhodes, we need to tap the fluid off his heart. 5 minutes ago, he was getting better, and now he's sicker than when he came in.
Okay. So the fluid's from acute pericarditis.
Stemming from the massive SS.
Drain's a temporary fix, but his heart is really struggling. CT chest will show exactly what we're dealing with.
He presented with hyperglycemia and gallstone pancreatitis. There was absolutely no evidence of a heart problem.
Time with Dr. Downey, not Dr. Latham. The one constant. Cardiac events can strike without warning. Bulky, swollen lymph nodes and a clear primary mass in the right lower lobe of the lung.
Non-small cell lung cancer?
The biopsy results are pending, but I'm almost certain they'll confirm it. I'm going to talk to Dr. Latham about surgical options.
All right. I'll consult with oncology, get their opinion as well.
Yeah. Hey, sorry, Nat.
Thank you.
So how long would I have to do chemo for?
That's up to the oncologist. Generally, it's given in cycles between 1 and 4 weeks long, followed by a period of rest.
How many cycles?
On average, 4 to 6.
What about side effects? The internet lists thousands.
It all depends on how Ted's body reacts. But yes, the side effects can add up. And because of the gallstone pancreatitis, they may even be exacerbated.
Well, all of this sounds awful. What am I looking at with surgery?
Removal of the mass via thoracotomy. I'll open your chest and peel away the growth from whatever it's attached to.
But my pancreatitis, a few hours ago, it was too dicey for gallbladder surgery. How is it okay with all of this?
Your cardiac function is compromised. Preventing heart failure has to be our chief concern.
Dad, I don't know what I'm gonna do. I feel like if I make the wrong decision right now, I'm gonna die.
Do you need an answer right now?
Ted, look, I understand this is all overwhelming, but you're very sick. The sooner we start fighting back.
Emergency radiation. Yeah, a single dose intended only to stabilize the mass in your lung. It'll give the pancreatitis a few more days to heal, and it'll give you and your dad more time to decide on a treatment.
And if I still choose surgery after, it'll be safer, right?
Theoretically, yes.
When can I do it? The radiation.
Today, I will set it up with the radiation oncologist.
Dr. Halstead, a moment.
Yeah.
Dr. Manning's patient, Ted Baylor. I understand surgery was proposed, but that radiation will be tried first.
Well, as a short-term measure.
Yeah, it's the size of the mass that's killing him. Radiation only stalls its growth. It doesn't shrink it.
Well, Dr. Manning's opinion and mine is that radiation is a much safer option right now.
Well, you're the attending. Keep me posted.
From now on, clean nutrition, lots of cardio, diet and exercise. My dad, too.
That's the enthusiasm I was hoping to hear.
I'm getting a second chance. I'm not wasting a day of it.
Good for you.
Okay, let's do this.
Natalie. Hey. I am so sorry that I didn't say something sooner. I was afraid I'd lose you. Say something, please.
I was terrified to move on from Jeff. Even more afraid to get involved with you, my husband's best friend. And yet I thought there is no one Jeff would approve of me being in a relationship with more than you. And you let me think that.
He's coding. I need help.
What happened?
He just dropped.
Take over compressions?
Got it. I got it.
No pulse, VFib. Charge 200. Charging. Hold compressions. Clear. Resume compressions. Another milligram epi. Charge to 300. Charging. Hold compressions. Clear.
asystole.
You gonna call it?
Time of death, 1732. He was dead before the first alarm even went off. COD, tumor lysis syndrome.
No way.
You know, the radiation was supposed to stabilize the mass. Instead, it caused it to burst. I might as well have just given Ted a lethal injection because that is essentially what happened.
Natalie, this is not on you. There are no predictors for tumor lysis syndrome. It is monumentally rare, even more so in young people. And the few times that it does occur, overwhelmingly, it's a reaction to chemo, not radiation.
It still feels like I missed something.
Well, you didn't. No doctor sees gallstone pancreatitis with diabetes and thinks volatile cancerous chest mass.
And yet here it is.
Ted's death is not your fault.